Well, speaking of healthy, we're talking about living healthy now, and joining us to talk about going in for a colon screening is Dr. Amy Schmidt with Women's Health Specialist. She's an OB, and good morning, good morning.
Good morning.
So first of all, I think the word colonoscopy scares people big time. It's like, oh boy, you know, mammogram's one thing, this is a whole another thing.
Right.
Let's talk a little bit about when you might think you might need one. What would be some of the warning signs?
Some of the warning signs that can be associated with colon cancer are really any significant change in a person's bowel function. Significant worsening in constipation, any change in the caliber of the stools, pencil thin stools, something like that. Any blood in the stool, whether it's bright red blood or dark black tarry stools, which can be a sign of old blood. Any of those kinds of signs are things that women should seek the advice of their healthcare provider.
Now let's talk about the age for screening. What is there a magic number, or does it have to do more with your family history?
It's kind of a combination. In average risk women without a significant family history, it's recommended that screening start at the age of 50.
Okay.
In women who have a history of colon cancer in their family, a first degree relative or close relative like a sibling or a parent, then it's recommended that they start screening about 10 years before their relative was diagnosed.
Okay, so 50, or if you've got history, earlier than that, talk to your doctor about that.
Yep.
What are some of the screening options?
Sure. There's a number of screening options available, anywhere from a simple stool test to a colonoscopy. Probably the two most common options that are employed are either a test called a FIT test, which is a fecal immunochemical test. What that means is it's a stool test that tests for evidence of blood in the stool. The way that test is done is the patient collects a sample of stool at home and then either drops it off at the lab or sends it in. If that tests positive, then they would go on to further testing. If that's negative, then they can be reassured that everything looks fine, and that's a test that should be done every year. The other most commonly used test is the colonoscopy. A colonoscopy, essentially the day before, the patient needs to do a bowel prep where they cleanse their colon, clean out the colon, and then they go into the doctor, and under sedation, a camera is inserted in through the anus, and it goes throughout the colon to look at the entire colon. With a colonoscopy, if any polyps, which are often the way colon cancer starts, if any polyps are identified, those can be removed right at the same time. If somebody has a colonoscopy that's clear and they don't see anything concerning, they don't have to do anything for 10 years.
Oh, that's great.
Yeah.
So are they, how long would somebody be, say, out of work, or, how long is the procedure normally?
The procedure itself is pretty brief, probably less than an hour.
Okay.
Typically, people would be advised to take that day off.
Okay.
The sedating medications will make them kind of groggy.
Sure.
But really the next day, they're fine to go back to all their normal activities, back to work.
That's great.
Yeah.
And then you get, I think we avoid so many of this test because we're nervous about it.
Right.
We're nervous that it might be painful. There's nothing better than the results, positive or negative, because then you can deal with it, right?
Exactly.
Don't put it off. Thanks so much. Appreciate it. You can read more about basically doctor's advice and a patient in this month's edition of Women Magazine. There's an article called Coping with Colon Cancer, and it actually deals with a woman who has it. So it's nice to read a little bit about it more in Women Magazine. Thanks again so much, Dr. Schmidt.
No problem.
Appreciate it.